Why are we showing you a machinery accident on a manual handling video? Well, it's our way of saying to you that we can take all of the machinery accidents that will occur in Australia over the next 12 months. In fact, we can take every non-manual handling accident and incident that occurs in every industry and every workplace, and they would still not come anywhere near the costs or devastation that manual handling injuries will cause in the same period. Non-manual handling accidents can have high impact. Things that may cause you to shudder, or at the very least think about how you may perform that job the next time. Manual handling generally suffers from poor PR because musculoskeletal injuries tend to happen bit by bit. It's a creeping disease that can sneak up on you barely noticed over long periods of time, because manual handling induced damage can consist of many minor injuries where you feel no pain, no discomfort. It is also crippling our healthcare system with an estimated $20 billion of claims for serious injuries each year. It's an expensive burden to the Australian workplace. But what about the potential costs to you, the individual?
It looks like the wear and tear from repeated stresses on your spine have given you a condition called spinal stenosis. It would appear as if the outer rim of one of your spinal discs has ruptured into the spinal canal, thereby reducing the size of the canal and causing compression and pain. So we're going to have to perform a procedure called a lumbar laminectomy to relieve that pressure. So let me explain how that works. First of all, we place you face down on an operating frame and we give you a general anaesthesia to put you to sleep. And then we make a small incision about 75 to 100 millimetres long in your lower back. Then we use a retractor to pull apart the muscle and the fatty tissue of your spine to reveal the lamina. We remove a portion of the lamina, and that reveals the ligamentum flavum, which is an elastic ligament that helps connect two vertebrae. So then we cut an opening in the ligamentum flavum to reach the spinal canal. And once the compressed nerve can be seen, we can then determine the cause of the compression and relieve the pressure on that spinal nerve. We then simply put all the muscle and the soft tissue back in place and stitch you up. The success rate is favourable. At least 70 to 80% of patients will achieve significant improvement in function. But there can be significant ongoing issues. There can be infection, there can be nerve damage and ongoing pain. Well, now that I've explained the procedure to you, are you ready to proceed with your spinal surgery?
What is manual handling? Perhaps the best place to start our manual handling PR exercise is to explain to you what manual handling is. Manual handling is any activity that requires force to lift, push, pull or carry, or otherwise move or restrain an object. Tasks that most of us perform every day. In the past, there were limits placed on the weights women and young males could lift, but this did very little to reduce the injuries suffered by workers. Injuries resulting from poor manual handling practices include muscle sprains and strains, damaged muscles, ligaments, invertebral discs and other structures in the back, soft tissue damage to nerves, ligaments and tendons in the wrists, arms, shoulders, neck or legs, abdominal hernias and chronic pain. Other common names for these injuries include RSI or repetitive strain injury, occupational overuse syndrome, cumulative trauma disorder, and so on. Manual handling injuries, illnesses and diseases can occur suddenly or over a prolonged period of time. Most jobs involve some type of manual handling, so essentially all workers are at risk, no matter how minimal they believe their work to be. Common causes include incorrect lifting techniques, bending or reaching for items incorrectly, slouched sitting or incorrect posture, twisting or jerking movements, a lack of appropriate rest, obesity and poor nutrition, stressful working conditions and living habits. Structure of the back.
Many of my patients nowadays have injuries that have stemmed from their work. Factory workers, office workers, Nurses, cleaners, no one seems to be immune. I've had patients that have literally spent thousands on all sorts of treatments looking for that miracle cure. If only they'd followed the simple procedure to begin with, their quality of life would be so much better.
Here is a severe back accident just waiting to happen. This worker is committing the mortal sin of lifting a heavy load. By lifting that far away from his body, he's asking for a back injury. In fact, if that were a 10-kilogram load, he would be putting approximately 700 kilograms of pressure on his lower spine. Let me explain. The spine is made up of a series of bones called vertebrae. Between each of these vertebrae is a shock-absorbing structure called a disc, which is made up of two parts, the inner and outer layer. The inner area is called a nucleus, which is roughly spherical in shape and filled with a semi-fluid jelly-like substance containing 88% water. This nucleus is kept intact and under pressure by several layers of strong fibers, which form the outer or peripheral part of the disc. The term slip disc is actually a misnomer because each disc is attached firmly to the vertebrae above and below it. However, the disc may be damaged by the tearing of those outer layers of fiber. Without you feeling any pain when pressure is exerted on the disc, the nucleus pushes out, and that pushing out effect creates tiny tears in the layers of fiber surrounding it. When that pressure becomes too great, it creates so many tears that a weak spot will form, causing the disc to bulge and in some cases, even rupture. When that occurs and you have the disc pressing against one of these nerves, suddenly you will have back pain of the most enormous and excruciating order. Obviously, the lower the disc is in the spine, the more pressure it has to withstand. The two lowest discs have to support the rest of the spine and the torso. This amounts to about 50 kilograms in weight. Now, because of its roughly spherical shape, the nucleus operates in the same way that a ball placed between two planes would operate. When that 50-kilogram weight of the trunk is exerted from directly above, the pressure from the nucleus is set out at all angles. However, when you bend forward, there are two things to consider about that 50-kilogram weight of the trunk. Firstly, because the center of gravity of the torso was approximately here, a levering effect takes place when you bend forward. In other words, the further you bend forward, the more pressure you place on the disc. For example, a person bending this far forward increases that 50-kilogram pressure to 350 kilograms. That's a ratio of 7:1. Secondly, instead of that 350 kilograms of pressure being displaced evenly by the nucleus because of the bending forwards motion, it will push and therefore place pressure in one direction only, backwards. Now that's with someone just simply bending forward. Ask them to lift, say, a 10-kilogram object from that position with his arms outstretched and with the levering effect taken into account. You are asking him to more than double that 350 kilograms of pressure on his lower spine. Studies have shown that it takes only 800 kilograms to smash or rupture a healthy disc in a 20-year-old's spine. But because the spine deteriorates with age, just 450 kilograms in someone 50 years or over. By simply keeping your back straight and the load tucked into your body, the pressure on the lowest disc in your spine would be reduced from 700 kilograms to 100 kilograms, not to mention virtually eliminating the pressure by the nucleus solely on the back of the disc. Here are some workers going about their daily work. Check out the different lifting techniques and the amount of pressure each person is putting on their spine. Risk assessment.
We had a situation here where we were going through a couple of thousand of a particular component every 5 weeks or so. The suppliers were packing them in boxes of 100, each weighing about 18 kilos. The weight wasn't a problem, it was the amount of boxes we were handling at a time. Each time we had a delivery, we'd have to stack the boxes on the middle shelf, so when it came to picking them, we wouldn't have to bend or reach. It made sense, really. Freddie cracked it one day and paid a visit to the supply office. He wanted to know why they couldn't supply the parts on one big outer so we could carry them around on a forklift with a specially built rack for easy access to the picking. One simple idea has saved us heaps of work and our backs too, I reckon.
Take time to look at the manual handling tasks in your workplace. Think about the possible risks associated with performing these tasks and discuss ways that these risks can be reduced or eliminated. Areas to consider when assessing risk are how often you perform the manual handling task, how long it takes you, whether bending, twisting, stretching or reaching is involved, the weight of the object, how far you have to carry the load, the layout and condition of your workplace, the organization of the work, your skill and experience in performing the task, the appropriateness and condition of any mechanical aids you are using, the nature of the object you are handling, whether it is slippery, wet, cold or sharp, or in the case of a person, whether they are heavy, light, can assist or resist, and other factors like your age and general health could also have some bearing. Once the risks have been assessed and recognized, ways of reducing or eliminating the risks should be looked at. Redesign the task is a great alternative. Redesigning the work, redesigning the workplace or the object handled. If that is not feasible, job rotation to minimize exposure to the risk for individuals should be considered. Mechanical aids may be a practical solution. There are an enormous range of mechanical aids on the market that, if used correctly and are properly maintained, can assist in reducing manual handling injuries. If a heavy object simply must be lifted manually, then a team lift using the appropriate lifting techniques should be completed. After this presentation, you should identify tasks that can be classified as hazardous manual handling. Assess the risks, such as posture, repetition, frequency and duration. Think about controlling the risks by altering the workplace, introducing mechanical aids, and continually training all employees on correct lifting techniques. Consult with each other on your experiences and ideas for a safer workplace. If you have the slightest feeling that an injury may occur, consult your manager or health and safety representative. Cooperate with your employer's instructions and training regarding both health and safety. Always participate in sessions with your employer that involves hazard identification, risk assessment and control. Lifting techniques and mechanical aids.
Young Sally's away again today, the third day in a row. She has torn ligaments in her right shoulder, the result of trying to lift a box down from the top shelf in the storeroom. We have procedures in place that stated that the stepladder in the storeroom should never be removed from there. We had one guy from dispatch borrow the stepladder and fail to put it back, and then we had Sally cut a corner because she was in a hurry. What do I do? We have procedures and mechanical aids to make the place safe, and the guys cut corners.
There are hundreds of mechanical aids, all designed to minimize manual handling in the workplace. If you are fortunate enough to work for an organization that has invested in mechanical aids, it is important that you do your part and utilize them. Think about what aids could benefit your workplace. Always discuss any ideas you have with your employer or health and safety representative. If a mechanical aid is not available and lifting an object just has to be done, a correct lifting technique can save you years of pain later. Always semi-squat to lift or lower an object. Never bend at the waist. Keep the lower part of your back bowed in while bending over. Keep the weight as close to your body as possible. In the case of a low-level lift, stand as much over the object as possible. Bow your back in and raise yourself with your head first. Turn with your feet, not the body. Never jerk or twist. Consider a dual lift if an object is too heavy or awkward to be lifted by just one person. In a dual lift, there should always be one person to call the action, so lifting is done simultaneously and smoothly. Conclusion. At the end of this presentation, it's important to take time to find out the following. What manual handling tasks does your job involve? With whom can you discuss your ideas to reduce the risk of manual handling injuries? Is there a procedure in your workplace for dealing with manual handling problems? Are mechanical aids available to assist you with manual handling? Is there a procedure in place for maintaining these mechanical aids? Is training in the use of these aids available? Are there any other tasks that you can perform so that you can return to work? Can you identify ways to make the tasks you perform safer? The topics in this presentation not only are beneficial to the workplace, but can also be adopted at home as well. Manual handling injuries, illnesses and diseases can not only affect the life of an individual, but can give the ripple effect through their family, friends and workmates. Ask yourself just one simple question. Am I doing my job the safest way possible?